It can affect your job, it can affect your leisurely activities, it can even affect your sleep.
We have to, of course, be cautious that may be suggestive of more serious pathology.
Our spine is a very important structure of our body. It allows us to maintain an upright posture, and every time we walk upright and walk around, the spine plays an important role. So spine health is actually very important to all of us. Unfortunately, there's many conditions that can affect our spine. And when spine gets affected, it usually presents with pain. And that can be very debilitating. When you have pain, sometimes it can affect your quality of life. It can affect your job, it can affect your leisurely activities, it can even affect your sleep. So spine health is an important consideration for all patients. I see. A lot of conditions can affect the spine. In neurosurgery, we commonly deal with conditions of the nerves, and as you know, a lot of nerves run through the spine. In our aging population nowadays, there is a lot of degenerative back conditions that can affect the spine. Our spine consists of many structures inside. The bones, the discs, the muscles, the ligaments, all can suffer wear and tear, and with age, these structures will wear down. And because nerves are running through all these structures, sometimes during the wear and tear, nervous structures can get compressed and patients will develop symptoms. The common symptoms that the patients develop are usually neck pain, back pain. Besides that, sometimes they can have nerve-related symptoms, shooting pain that can go down their arms, their legs. Sometimes this can be associated with numbness, sometimes even weakness. And these are some of the common symptoms that they present with. On top of that, neurosurgeons, we occasionally see tumors related to the spine. Sometimes they can be tumors that have spread to the spine. Sometimes it can be tumors that arise from the spine itself. So all these are actually common conditions that we deal with in neurosurgery. So as with all medical conditions, we will need to take a thorough history and do a proper physical examination first in order to pinpoint the diagnosis. With the improvement of medical imaging nowadays, a lot of times for spine conditions, we supplement with MRI imaging of the spine. With the improvements of all this medical imaging, nowadays we can see very fine details inside the spine, and we can pinpoint exactly where the nerves, which nerve is causing the problem and which nerve is being affected or compressed within the spine. So these are the common things that we will do during the consult. After which, once we have confirmed the diagnosis, then we can formulate a treatment plan. Not all problems require surgery to address the problem. Sometimes some conditions, if mild, can be treated conservatively.
I think the first step for us would be to get an understanding of how and when the spinal issue started and what the patient's main concerns are. Is it spinal pain that is an issue, or is it spinal stiffness? If it is spinal pain that's the issue, then we need to chase where the area of symptoms are, and if there are radiation of symptoms into the arms or legs, what the triggers are to the symptoms and what the symptom behavior is like through the day. We have to, of course, be cautious in screening for signs or symptoms that may be suggestive of more serious pathology that may warrant an onward referral to a medical doctor or specialist. If we deem that physiotherapy management is appropriate, we will then go on to perform a comprehensive physical assessment that may include assessing spinal range of motion, joint stiffness, muscle strength and flexibility, and maybe a neurological examination if there is suspicion of nerve involvement.
So the management of spine problems has improved a lot over the years, namely in a few fields. With the improvement of medical imaging, we can now see a lot of detail on our scans. CT scans have improved, MRI scans technology has improved. Because of the increased resolution, we are able to pinpoint with greater detail where the problem is coming from and make more accurate diagnosis. This is in conjunction, it complements our physical examination as well as our thorough history taking. So everything is complementary. It helps us to come with a diagnosis better. In terms of surgery wise, the technology has improved as well. So nowadays with better instruments for spine, better operative microscopes, as well as intraoperative navigation that we use during surgery, all these improvements have made spine surgery a lot more safe. Yeah. So because of that, we are able to maximize our outcomes. We have been able to reduce our morbidity and risk from spine surgery. Hence, more patients benefit with all these improvements in technology. And I must say, spine surgery has become much more safer nowadays.
These days, with the assistance of technology, such as MRIs, that has allowed us to provide a more accurate diagnosis. It allows us to rule out serious pathology and to be more confident with prescribing physiotherapy treatments. If we look at physiotherapy treatments in particular, then in recent years, dry needling has become quite popular in the treatment of spinal-related conditions. I personally use it quite frequently, and what it essentially is the insertion of needles into muscle trigger points to relieve muscle pain and tightness. There seems to be good emerging clinical evidence to show that it is highly effective in the treatment of spinal-related pain. Okay, so I think it boils down to two things: what the patient's main concerns are and what their goals are in terms of physiotherapy. If spinal pain is the issue, often patients will say that they just want to get rid of the pain. However, this is a very vague goal, and what I find usually more effective is for them to develop more specific functional goals. So for example, if the goal in 6 months is to run a half marathon pain-free, then now they have an end goal to work towards, and from that end goal we can start to formulate shorter to medium term goals to help them get to the end point. I think the key here is to give them small wins so that you can keep them motivated throughout the rehab program. Of course, there will be other considerations such as whether there's adequate access to exercise equipment and whether they have enough time within the day to do their exercises. However, I'm always happy to prescribe around their constraints or schedules. It can even be starting with something simple like prescribing one exercise to do 1 time a day. I think the thoughts here would be that once they start to see the benefits of doing the exercises, they are more likely to continue to comply with the rehab program.
A lot of patients, when it comes to the spine, they are always worried about dangerous, big surgeries and very high risk kind of surgeries. So I think it's time to change that concept. The patients should be aware of the spine conditions and should seek help early. That's what we think has changed the most. Spine surgeries nowadays has become much safer. So if we can pick up the conditions earlier, a lot of times we can do a much simpler treatment and the risk of the treatment can be reduced as well. So I would advise all patients, don't suffer in silence. If you have very bad neck or back pain, do seek treatment, do seek medical advice early. There's a lot of things that we can do, and not all conditions need surgery to address the problem. If you can pick up the conditions early, if you institute proper treatment and physiotherapy at times, sometimes we may not need to go down the surgical route. So it is important to address the problems early, to seek help early. So there is no magic formula to prevent or correct all spinal conditions. Everybody's body anatomy, the body habitus is different. Everyone's spine conditions are different as well. So normally we would advise to keep a healthy and active lifestyle. A lot of times we will recommend exercises such as swimming, yoga, All this help to maintain a fit and strength of your muscles, and while maintaining the range of movement of your spine. All these help to prevent further degeneration of your back. We will usually advise to avoid carrying of excessive heavy loads, because all this can put extra stress on your spine as well, and sometimes may increase the degenerative conditions affecting the spine.
Okay, so I think some of the common exercises that I give would be maybe exercises for office workers, because they spend long periods of time sitting in front of the desk. So sometimes what I recommend them to do are certain stretches for the lower back and the neck. For the lower back would involve spinal rotation. So it's often more helpful if you have an armrest by your side, but even with a regular chair, you should be able to hold on to the edge of the chair and feel a stretch through the muscles that help to rotate the lower back. For the neck muscles, what I often like to give would be stretches across to the side. So that helps to stretch the trapezius muscle here on the left hand side. And there's a variation of that involves moving into this 45-degree angle and pulling forward. And now they should be able to feel that stretch through the more vertical component of the muscle. So on top of these exercises, what I often recommend them to do is also to take frequent breaks through the day. So it can be something simple like standing up every hour or so, going to the toilet, getting some water. I find that change in posture helps to minimize the chance of spinal pain episodes from happening.
So in the treatment of spinal conditions, we believe in a multidisciplinary approach. Not all conditions of the spine require a surgical treatment. A lot of conditions in the early phases, especially degenerative spinal conditions, can be treated conservatively. Sometimes this involves the use of simple medications to help to reduce inflammation and pain. And sometimes it involves the treatment with physiotherapy, with the help of a qualified physiotherapist, to institute stretching exercises, range of motion exercises. All this can improve the spinal health and prevent further degeneration of the spine. So we believe working together helps to achieve the best outcome for spinal conditions.
I like to think of myself as someone that helps to optimize human movement. And if we use the analogy of a car, the surgeons are usually the ones that help to replace faulty mechanical parts, and we as physiotherapists help to tune these mechanical parts so that your car can have the best possible performance. Now, if we have looked at the way your spine moves, and if we feel that there is a better way to move, we have a variety of interventions at our disposal. If a joint is stiff, we can mobilize or manipulate it. If a muscle is weak, we can strengthen it. If a muscle is tight, we can release it or stretch it. All these interventions, when used in conjunction with appropriate postural and ergonomic advice, can help to improve and maintain spine health. So I think regular exercise is important in maintaining spine health. Other advice that I often give to patients would be maybe in terms of ergonomic advice, such as the usage of a standing desk or an ergonomic chair, and we would help them to set it up so that it reduces the amount of stress on their spine. In some cases, we also prescribe advice such as the types of mattresses to use or the types of pillows to use to minimize spinal related pain.